All right, let's talk about something that's way more common than you'd think, that overwhelming feeling of being in a tight space. Today, we're going to dive right in and explore the anatomy of claustrophobia.
Okay, be honest. Have you ever been in, say, a crowded room or a stuck elevator and just felt that sudden, intense urge to escape? Like the walls are literally closing in? Yeah, that feeling. It's a really primal human response, and we're going to get to the bottom of it today.
So let's actually put a name to this thing. Officially, claustrophobia is an intense, irrational fear of enclosed spaces. And that word irrational is super important. Think about it. It's like this ancient survival instinct, right? The one that would have screamed, "Don't get trapped in that cave." But it's misfiring in our modern world. And even if the danger isn't real, that feeling of panic, it is absolutely terrifyingly real.
Okay, so to really get this, we've got to break it down. First up, we're looking at the anatomy of the fear. We're going to dig into where this thing even comes from and what it actually feels like both in your body and your mind.
So the first big question you're probably asking is, where does this even come from? I mean, a fear this powerful doesn't just pop up out of nowhere, right? The truth is, its roots can be pretty complex, and honestly, they're different for just about everyone. And when you look at the potential causes, it's actually pretty fascinating. For some people, it's tied to a really specific traumatic event, like getting trapped somewhere as a kid. For others, it's more of a general fear, like a fear of suffocating or just completely losing control. And get this, it can even be something you learn from others, maybe from your family, or it could be a sign of a more general anxiety disorder.
But here's the thing. This fear isn't just in your head. It's not just a worry. When that trigger gets flipped, it sets off this whole cascade of very real and very powerful physical reactions in your body.
It's like your body's fight-or-flight system just goes into complete overdrive. We're talking sudden sweating, that awful tightening in your chest that makes it feel impossible to breathe, and a heart that's just pounding like it wants to escape. And remember, these aren't things you can control. They're totally automatic.
And of course, where there's a physical storm like that, there's an equally overwhelming mental one happening right alongside it.
So yeah, this is the other side of the coin. All those physical symptoms, they come with this huge wave of anxiety, which can even turn into a full-blown panic attack. And what does that do? It creates this incredibly powerful, primal need to just get out, now. And that leads right into the next logical step. You start actively avoiding any place that could possibly make you feel that way again.
Okay, so we've got a pretty good picture of the internal experience now. But what does all of that actually mean for someone's day-to-day life? Well, that's what we're looking at next in the Daily Impact. We're going to see how this internal fear literally reshapes a person's entire world.
And let's be clear, this isn't just about being a little uncomfortable in closets. Claustrophobia can put up huge roadblocks in life. Think about it. Travel on a plane or a subway, that can become an absolute nightmare. Certain jobs might feel completely off limits if they mean using an elevator or working in a small office. And even really important medical procedures, like getting an MRI, can feel totally unbearable. It has a real, tangible impact on everything.
I know. After hearing all that, it can sound pretty daunting. But this is where we turn a corner. Because in our final section, Pathways to Relief, we're going to talk about the good news. There's absolutely a way out of the fear.
And I really want you to hear this next part because it's probably the most important thing we'll talk about today. With proper treatment, many people can manage and reduce their fear of confined spaces. Just let that sink in for a second. This is something that can be managed. It is not a life sentence.
So, what does proper treatment actually look like? Well, there are kind of three main pathways we can think of. First, there's professional therapy. A big one is cognitive behavioral therapy, CBT, which is all about helping you rewire those anxious thoughts. It's often paired with slowly and safely exposing yourself to triggers. Second, you've got relaxation techniques you can use right in the moment, things like controlled breathing and mindfulness. And third, for really severe cases, medication can be a huge help. So if there's one big takeaway here, it's this. That fear can feel so mysterious and so powerful, right? But just by understanding it, by knowing where it comes from and what it's doing to your body, that's the first and most crucial step to taking its power away.
And that's really where we're going to leave things today. So for anyone out there who's ever felt this or knows someone who has, here's a final thought to chew on. What could you do? What could your life look like with freedom from that fear? What doors would that open for you?